If you're wondering what EMDR is, you're in the right place. My name is Victoria Lacey, Principal Psychotherapist at GetCBT. In a nutshell, EMDR is a therapy that helps your brain to process traumatic experiences that are still affecting you now. Like cognitive behavioural therapy, EMDR is an evidence-based treatment for post-traumatic stress disorder, but it can also help reduce the intense emotions about traumas that are linked to other problems like low self-esteem, phobias, social anxiety, generalised anxiety, or body dysmorphia. EMDR stands for Eye Movement Desensitisation and Reprocessing, which I think is a bit of a mouthful. So what does it mean in real terms? Desensitisation refers to one of the primary goals of treatment, that is, helping your nervous system to become less sensitive to traumatic memories by reducing the vividness and intensity of emotion associated with the memory. The other goal, reprocessing, is about reconfiguring the brain by updating the difficult meanings of the trauma that you have now with, for example, new insights, changing what you believe about yourself or what happened, changes in how your body feels when you think about it. And all these get stored in your brain and will guide you later on in life. So the way we achieve desensitization and reprocessing then is by considering a meaningful aspect of a trauma memory and then noticing where our mind and body takes us. On a journey. You'll see where this is going in a moment. But this is done while the therapist will help you stimulate two different sides of your brain. This is called bilateral stimulation, and it's done using eye movements. Now, I should say here that the term eye movement in EMDR is a bit of a misnomer because your therapist can use different kinds of bilateral stimulation, such as sounds in each ear or tapping, and your therapist will probably explore which one is right for you. So, I'm going to tell you now about 6 ideas and concepts which are central to the EMDR journey, and we're going to do this using the well-known train analogy. Number 1, before we set off on our journey together and do any reprocessing work, your therapist will help lay a foundation which is designed to help you feel safe and supported on this journey. This might be in the form of a safe space imagery. Number 2, you'll begin your reprocessing journey in the station, starting off with your target memory, and your therapist will help you identify what negative thoughts about yourself are connected to it. Number 3, just like riding a train, the sounds, images, body sensations, thoughts and feelings related to your memories will pass by, just like the scenery outside of a train window. Number 4, on your journey, your therapist will support you to remain present while moving through tunnels as you notice those images, memories, thoughts and feelings that pass by, and they'll gently encourage you to keep moving forward and come through the other end of any tunnel that you go through. Number 5, you are safe and your therapist will be in the seat next to you the entire time. You might notice you end up in a completely unrelated station for a moment. Whatever comes to mind, just report about it briefly and we move on to more bilateral stimulation. Number 6, your job will be just to notice what is passing through your mind without judgment or analysis. Eventually, what you notice is that looking out the window will be less difficult and painful. So if PTSD or other trauma symptoms are making your journey through life distressing and unpleasant, then why not get in touch with a qualified therapist and find out more about how EMDR could work for you. Please like and subscribe for more animations and tips about CBT and EMDR.